reminds us the critical role we play in guiding adolescents through this transformative phase. On behalf of Chhattisgarh AHA, I, Dr. Shilpa Bhargava, Secretary, Chhattisgarh AHA, would like to welcome you all the respected participants, distinguished delegates, galaxy of intellectuals, seniors, juniors, and colleagues to this webinar series, Adolescent Counseling in Office Practice, Basic and Beyond, which is well proposed, designed, advised, and convened by Dr. MKC NAIR Sir, Dr. PREETI GALAGALI ma'am, and Dr. Kavita Meghani ma'am. Welcome to our webinar series, Adolescent Counseling in Office Practice. Today, we gather to explore the art and science of adolescent counseling, a field where empathy and expertise converge to shape the future of young individuals. As William Wordsworth eloquently wrote, "The child is father of the man." Our interactions with adolescents today lay the foundation for the adults they will become tomorrow. Effective counseling is not just about offering solutions. It's about listening, understanding, and empowering our young patients. In this series, we will delve into the basics of counseling, uncovering the fundamental skills that every practitioner must master. We will then venture beyond exploring advanced skills and strategies to address the diverse and complex needs of adolescents. To know how to suggest is the great art of teaching, as said by Henry Frederick Emil. Our esteemed speakers and experts will share their wealth of knowledge and experience, providing invaluable insights to enhance your practice. Without further ado, let's commence this enlightening journey. And I would like, with a great pleasure, we extend a gracious welcome to our guest of honors for today's Elite event, Dr. Basant Kalatkar, Sir, President-elect, Central IAP 2025. I would like to welcome, Sir, on this webinar series. Dr. Anup Verma, our respected guest of honor for today's Elite event. He is Scientific Coordinator of Chhattisgarh IAP, as well as a senior pediatrician and a very good orator. Dr. Kiran Makija, Sir, President, State Chhattisgarh IAP. I welcome all of our esteemed guests of honors today. Your presence brings immense value, and we are thrilled to have such an esteemed guest with us. Also, I would like to thank and welcome Honorable Dr. Basavaraja Sir, National President, Central IAP. Although he is busy somewhere, he will join us very soon. Respected Dr. Yogesh Parekh, Honorable Secretary General, Central IAP 2024 and 25. Atanu Badra, Sir, Treasurer IAP 2024 and 25. Dr. Basant Kalatkar, Sir, again, our President-elect Central IAP 2025, who is today's guest of honor as well. Dr. Upendra Pindwadekar, Sir, Past President IAP 2023. We are delighted to have all of you for this seminar and make this session enriched. It is our distinct honor to welcome our distinguished guest, Dr. Geeta Patil, Ma'am, Chairperson, Central AHA 2024, Dr. Prakash Veer RSR, Honorable Secretary, Central AHA 2024, Professor Hema Bindu Singh, Ma'am, Chairperson, Elect, Central AHA 2024, Professor Sukanta Chatterjee, Sir, Immediate Past President, Central AHA 2024, and Dr. Sneha G. Gatkar, Treasurer, Central AHA 2024. We appreciate your presence and looking forward for your blessings. We are privileged to welcome Dr. Ashok Mehta, Sir, Executive Board Member, Central IAP 2024 from the state. Respectable Dr. Kiran Makija, Sir, State President, Chhattisgarh IAP 2024. Dr. Arun Agrawala, Sir, State Secretary, Chhattisgarh IAP 2024. Dr. Nilay Mujarkar, Sir, Treasurer, Chhattisgarh IAP 2024. And other seniors who are the pillars and pioneer of academy in Chhattisgarh for adolescent as well as IAP, like Dr. Madhushri Deshpande, Ma'am, Dr. A.P. Sawant, Sir, Dr. Amar Singh Thakur, Sir, Dr. Ashwini Agrawal, Sir, Dr. Umesh Khurana, Sir, and last but not the least, our respectable Guruon ke Guru, Padma Shri Dr. A.T. Dabke, Sir, and Padma Shri Dr. Pukhraj Bafna, Sir. It is my honor to welcome you all. Your presence is a great honor and signifies the importance of our collective endeavor. We would be honored if Dr. Yogesh Parekh sir could share a couple of thoughts with us. Sir, I think sir is not here. I would like to request our guest of honor, Dr. Vasant Khaletkar sir, to kindly share his thoughts with the audience and address the gathering. Joshi ji, please unmute, sir.
Madam, sir can unmute himself.
Unmute, sir. Khaletkar, sir.
Khaletkar, sir, please unmute yourself.
Good evening, all.
Yes.
Am I audible?
Yes, yes, sir.
Yes, sir. Yes.
Yeah. Good evening from Chennai. Welcome as greetings from Central IP as the President-elect 2024. And thanks for invitation. You invited. I was busy, but I couldn't stop me to attend this Adolescent Health Academy's program, and that to be from Chhattisgarh, which is my neighboring country, the neighboring state. I think Chhattisgarh is a part of the Maharashtra always. Always, this all people are so near dear to me. And respected MKC NAIR sir, Pukhraj Bapna sir, my both are my mentor. My friend Dr. Anup, Kiran, Ashwini, Dr. Kavita, and Secretary, and respected Adolescent Health Academy President Dr. Geeta Patil. This is really pleasure to come as a guest of honor for this adolescent. And I, frankly speaking, I grown up with the help of the mantras given by Dr. MKC Nair. When he was a president and he came to Nagpur, I was the master of ceremony when Nagpur IIP got installed and he was the installing officer. So with his mantras, I grown up and I become the president. Thank you, sir. Thank you. And Dr. Pukhraj Bapna always advisory for me. Always, whatever any problem, I always ask Dr. Pukhraj Bapna. So he's the best advisor. I want to talk about Adolescence. Adolescence Academy is always on forefront of every chapter. Initially, I know there were few chapters which were in forefront, but nowadays only everybody is talking about adolescence health and adolescence. And today's topic about adolescence counseling, really, this is the need of the hour. You saw the incidents of Pune, and really, we need to teach all the adolescent people how to go ahead, how to behave, and so many topics. I had a discussion with Dr. Geeta Patil. We are planning some training program for these adolescents through IIP, and I know you all people are there to help me in out that in year 2025. I wish you all the best. Thank you.
Thank you, sir, for your words of wisdom. And now, with distinct honor, I would like to request Dr. Kiran Makija, sir, our guest of honor for today's event, to share his influential thoughts with us today.
Thank you, Shilpa. And first of all, I thanks Chhattisgarh AHA for inviting me and as a guest of honor, and respected Khaletkar sir, our President-elect of Central IIP, respected Pukhraj Bapna sir, Padma Shri Dr. Pukhraj Bapna sir, who is our fatherly figure of not only of the Chhattisgarh but of the all the AHA members of the whole of the India, respected MKC NAIR sir, our teacher of teachers. Many of the students, they have getting the advantage of what he has said, that he has started with the sexuality in the topic, and many of the students, they are making money out of that. But no, sir, you are actually the teacher of teachers, and we have the full of respect for you. Respected our PREETI ma'am, who is not only the national speaker, but also international faculty also. And we are fortunate so many of the learnings we had in our sessions in Chhattisgarh. Definitely, we already have achieved so many, and it is endless topic. And we will have another talk today from her. Respected Geeta ma'am, who's the president, who's the chairperson of the chapter this year, but she's of the full of the knowledge, and she had already shared in our first of the webinar what the Kavita is running, and our Chhattisgarh AHA, we can proudly say that she, under the leadership of Dr. Kavita and the great work of Dr. Shilpa, we are having the webinars. Well, many of the webinars we had already, and they have planned so beautifully the series of webinar for all of us for the topic adolescent counseling. And counseling is not just a thing what the one we give to the parents or the adolescent, but it is actually the mutual understanding and many of the views, whatever we don't have also in our mind, we also gathered at the same time when we counsel the adolescent. So adolescent is just as our friend, and we need to give time and we need to have sympathy or empathy at the same time. So with this, I congratulate CGAHA and give the best wishes for the series of webinar, and hopefully these webinars will be the will have the great success. As we are witnessing today, more than 200 delegates are attending this webinar, so I give the best of luck to them also. Thank you very much.
Thank you, sir. As Dr. Anup Verma sir is busy in some prior commitments, so he is not with us in this webinar, but his blessings are always with us. So moving ahead, I would like to warmly invite Professor Hema Bindu ma'am, Chairperson-elect Central AHA, to share some brief reflection with us.
Unmute Hema Bindu.
Yeah. No, yeah, I was waiting. Yeah. So very good afternoon to all. My respected MKC NAIR sir, my teacher, respected Bafna ji, and Kiran Makhija, Arun Agrawal, and Kavita and Shilpa, and all the other stalwarts, and my colleagues in Central AHA and CHHATTISGARH IAP. Greetings from this AHA. I really so happy that Kavita has designed this very practical sessions. And we have, I think, she has designed a number of sessions, and we are all looking forward. The attendance itself shows us keen interest in these practical sessions. CHHATTISGARH AHA for bringing out these sessions, and we are looking forward to great work at the ground level. Even myself and Dr. Geeta, we are the whole year we are celebrating a lot of academic sessions are happening, and we're also looking at in Pedicon 2025 Hyderabad. We all welcome you, and let us start another year next year when I'm there on the chair, something for the adolescents at the ground level. And we are designing good either a workshop or a TOT for the next year. And let us see, we all have to work together. 3,200 members can really create a lot of change in IAP for the youth. Thank you. With this, I really bring in the best of luck and blessings to the AHA of Chhattisgarh to design this webinar series, and all the best to all of you. Thank you.
Ma'am, thank you.
Thank you, ma'am. It would be wonderful if our chairperson for today's session, Padma Shri Dr. Pukhraj Bafna sir, could share their concise thoughts with us.
Unmute, sir.
Sir, please unmute.
Can you hear me?
Yes, sir.
It's a great pleasure today to have this webinar, particularly our guru, Dr. MKC NAIR, and our great friend, Dr. PREETI GALAGALI. I welcome you all on behalf of myself and the AHA and all the pediatricians from Chhattisgarh. These seminars, these are need-based and problem-oriented, and I'm sure stalwarts and legendary figures like MKC and PREETI would definitely not only show the path, but will be something great to listen to them. Of course, meeting MKC after a long time, but I'm sure his mantras will give a lot to us regarding adolescent health. I welcome you all, not waiting, wasting much of your time. Thank you so much.
Thank you, sir. We humbly ask Dr. Geeta Patil ma'am, Chairperson, Central AHA, to address the gathering with a short statement.
Thank you very much. I agree with Kiran Makhija, sir. Chhattisgarh AHA is in the forefront of all the academic activities which we are observing, not only Adolescent Health Academy. And the way the coordinated and structured programs are going on, Dr. Kavita, Dr. Shilpa, and very aptly supported by the seniors like Madhushi Deshpande, Samant sir, Thakur sir, Arun Agarwal sir, and all of them are arranging. And all of us, we know that counseling is the backbone of the adolescent medicine. Without learning the counseling, see, we don't want to go into detail because we are going to learn from the experts. You can't practice the adolescent medicine, though you may be very good in the knowledge. If you don't have skill of adolescent counseling, you cannot do well. And all the criteria of adolescent counseling are very important for us to cultivate. And let me tell, our Adolescent Health Academy, our monthly webinars, or maybe not only monthly webinars, but other programs are also viewership is very high. Today only it is proving that just a short period, 216 people are there, and it may increase also. And these are the series of webinars with the experts. Definitely it is going to make a lot of impact, and definitely it is a need of the day to learn these things, because everyone knows that the tilt of the so many adolescent, so much pediatric care has gone to the adolescent healthcare. Many under 5 pediatric problems are getting solved. Now time for us to give this attention, because it gives a lot of benefits. Always we say triple dividend, so we cannot ignore. And do you want me to introduce the speaker, or you want me to introduce the speaker later?
Ma'am, I just want to try to introduce our respected chairpersons, you and Bhavna sir. It is just like Suraj ko diya dikhane wali baat.
Madam, problem is we are running short of the time.
Yes,
Let us listen to the experts. So I
Sure.
suggest, Rita, let me
The
introduce.
speakers are very well known to everybody. Very
Yes.
well known to everybody.
Sir, he is known to everyone, but I want everyone to know about him. There are few people may not be knowing all the aspects. I want to highlight them. Certain things are maybe we know, certain things we may not be knowing. So let me tell about him, and it's a great honor and prestige for me. Let me not lose that opportunity to introduce MKC.
Sure, ma'am. Sure,
And sir is definitely a person.
Yogesh will join, share the slides of sir.
Sir, MKC sir is a great academician with a far vision. And on behalf of Adolescent Health Academy, my team, me, my successor, Dr. Himabindu, immediate past chairperson Sukanta, we all are there. We welcome first speaker and we welcome this activity. All of us, we know about MKC sir. Currently, he is a professor emeritus in developmental, behavioral, adolescent, pediatric and child developmental center, and he is the former vice chair chancellor of Kerala. But I think few things are not mentioned in this CV. Let me tell that. He's a past IAP president 2004. He's a past AHA president 2007 to 2009. Past NNF president 2011-12. And he was a Indian Clinical Epidemiology Network 2005-2007. So, and he's the first founder of this CDC center. His efforts in bringing up the center as an autonomous center of excellence in early child care, education, adolescent care, premarital counseling. This is the thing which is very important, and women's welfare and associated fields is definitely incredible. He has got a far vision. He recognized the social, economic, cultural value of the child development, and he worked towards that. New screening techniques. All of us, we know about the techniques, training methods for last 3 decades. We know 2004. postgraduate diploma of adolescent medicine started in 2004. He is globally acknowledged as a pioneer in the field. Trivandrum developmental screening chart. All of us we know from our postgraduate day, and we are always learning new things from him. And this is a part of our RBSK program also. To his credit, there are 210 national and many international journal publications, 29 medical books as an author and editor. Still, he continues to write. Recently, also, there was one book I read recently. And it is a national asset for the research and teaching and training in child and adolescent development. There is a lot of study done of the low birth weight babies. And he is awarded Doctor of Science degree by in this history of University of Kerala. His 45 years of counseling experience has benefited many adolescents as well as the pediatricians to learn many things. And it helped him immensely in the student guidance and support program in all the colleges when he was a vice chancellor. Please remember this, no vice chancellor does this work, and he is known for that. And it is a benchmark achievement. He was currently, all of us, we know that he's working as in a child development research center, Medicity campus, Trivandrum. He's been, apart from that, he has been nominated as a governing body member of Board of Management of Nurullah Islam Center for Higher Education, CDC Center, National Institute for Physical Medicine Rehabilitation, National Institute of Speech and Hearing Center, Health Management. And if I go on, many hours will go in that. So he's an authority in developmental pediatrics, adolescent, and very important, there are 2 orations in both the branches on his name, in the adolescent medicine as well as in the neurodevelopment chapter. So I don't think that hardly anybody in India would have achieved what he has achieved. So it is a motivating factor for us. I'm not making attempt to introduce him, but this is an introduction to motivate many to do good work. And I end this by thanking to the center, Chhattisgarh AHA for giving me opportunity to introduce a stalwart. I don't say stalwart. He's our teacher, mentor, guide to many. So should I hand over Kavita to Shilpa or to sir to start?
I think, ma'am, you can hand over to sir to start the
Sir,
talk.
I think, thank you very much, sir. I have taken 5 minutes extra of your in between. But sir, this was required because people have to know about you, sir.
Thank you.
Thank you very much, sir.
Shall I share the screen?
Sure,
Yes.
sir.
Yeah. Is it coming? Some problem?
Yes, sir.
Is it okay?
Yes, sir.
Is it okay, or shall I try make it full? Sometimes it won't move if you make it full.
Sir, it is not in full screen. Can you please make it in slide mode?
Slide mode. The
shows,
problem
slide
is
shows.
sometimes it doesn't move if you do that, but I'll try.
Okay. So it's fine, sir. You
No,
can
no.
start with this.
Is it okay now?
Yes, yes.
sir.
Yes.
Okay. So good afternoon, all the senior stalwarts. I won't take any time introducing anybody. My gratitude to Chhattisgarh Group, the Indian Academy of Pediatrics, Adolescent Health Chapter, and all my gurus, my contemporaries, and my students. One thing we must learn, from all the seniors, particularly Pukhraj Bafna sir, is that maybe he is older to me, but still, because I have taught him, introduced adolescent to him way back, maybe how many years, 30 years ago, he still remember me as teacher. I think this is something we should carry on in life. And that's a very important point I want to say. The routine adolescent counseling part, we have covered it many times, so I'm not going to details of that. I will introduce a little new thing today, the self-counseling part. Okay, next one. Now, but still 1 or 2 words about counseling may be required, but I will do self-counseling. Now, why do we need self-counseling? the reason is we have so much of problems. We cannot provide counselor for everything. All my life, I have gone through miserable problems. And in fact, now I am going through the same thing. Because in the process of trying to change from a pediatrician to a developmental pediatrician, adolescent pediatrician, etc., so many problems come up to build a child development center. At every day, I can't come and cry at home. I can't do that. So how did I manage? I managed by self-help. Fortunately, I never had to go to a counselor, but I have done a lot of self-counseling. And what is this self-counseling? It's a process of examining one's own behavior using psychoanalytical methods and free thinking and free association. Okay? What is free thinking? Free association. We'll talk about it later. Self-counseling can help one to take more effective control of everyday situations and enable to make continued progress. That means personal growth. The one thing I learned, and that's the biggest thing you remember, when something goes wrong, learn to believe that God has a different, plan for you. Don't start crying about what went wrong. Think that if this went wrong, it doesn't have to be always bad for you. It may be for God has different plan. All my life it has happened. And the only one I tell you, I didn't get admission MBBS, just miss it in Kerala. That's why I went to Punjab, CMC Ludhiana here, which made me what I am today. I had the opportunity of studying with students from all over India. So something go wrong, first message is when something go wrong, don't start crying as if it's the end of the world. You still have many, many opportunities that may be coming. Now, this slide has shown many times, but I like it very much. Somebody has done work on all the people, achievers in the world. And what they found, whether it's a doctor, engineer, anybody, think of anybody, administrators, IAS, everybody. In every institution, there will be 2.5% who are innovators. Most, we'll say mad fellow, crack fellow, all that crap we will tell them because they keep on doing something new. But there are 13.5% who are not, nobody will say they are crack, but they will pick up from this crack, so-called crack, and do something. So together there is about 16%. It is this 16% who make sure that rocket will go, missile will go, atomic energy will work, army will work. Everywhere there is 16%. On the other end, you have 16% who are so-called laggards. Don't beat me, I'm not going to improve. The administrator will try to give, memo and all that, but a manager, smart manager will never give memo, never say anything, tolerate him for the salary you give, but make sure that he is not a nuisance for the whole institution. If you try to target him, he will try to target you and, spoil the whole atmosphere. But the majority is early majority 34, late majority 34. If you can bring these two in a classroom of 100, this is exactly what happened. 34 plus 34, 68 plus 16, nearly 84%. 84% will be on your side if you can bring the late majority to early majority with simple thing. How it works? Self-counseling take you on a journey of self-discovery. You work at your own pace and in the direction you feel most comfortable with. Some problems may be too deep-seated for self-counseling, and these may require additional forms of therapy. So majority of school children who have problems give the capacity to them from very young age to find out what is their problem and start thinking from the other person's point of view. When the child will come and tell you, my friend is beating me, he is scolding me, he is, making fun of me, this thing and all that, then think that why did he do? It may be his problem, but also may be that you are not able to do it properly. Think from both sides. If you start thinking from both sides, then you yourself can analyze what was the provoking thing that you do. Most often you provoke something. Just think that it is your, not self-blame, but just thinking right. Now, two problems, I must say that it's a serious problem for adolescent pediatricians. One is anxiety disorder, other one is the depression. Now, what is the level of anxiety disorder in a community of supposed to be normal adolescents? No complaints, no screening, nothing. They have 14.4% by DSM-4 criteria. If you go for international 8.6, but Indian scared cutoff 25. Take an average of all this. You sure that nearly 15 to 16%, or even up to 17, 18% of children in the community do have anxiety as a problem. So that needs treatment. Similarly, depressive disorder concurrently present in 24% with anxiety disorder. This is a very important message. If you have a child with anxiety disorder, invariably at least 1/4 of them will have depressive disorder, depression. And as the severity of anxiety increase, severity of depressive disorder also increase. And AD is more severe in those with depressive disorder. So all this say that they go together. But fortunately, the drug that we give, whether it is fluoxetine or any drug, it applies for both. Depression, you need 20 milligram. The other one, you need 40 milligram, double the dose sometimes. But drug is same and both are concurrently present. That's the most important part. Then the COVID situation had made it really worse because in 15 studies describing nearly 23,000 adolescent Indian children, put together, they say about 80% had behavior or psychological problems. Depression, 42%. Anxiety, 35%. This is not a small number. I can vouch you. We did a study in the COVID period in Kerala for the UNICEF. It showed similar findings. So that means a huge number of undetected anxiety and depression is available in the country. Even if you are a simple, busy, practicing pediatrician, do not know much psychiatry, do not know much counseling, you can treat these two conditions. My key message is that if the child talk about suicide tendency, please give to psychiatrist. Don't play fool with it. But you can treat anxiety, you can treat depression, and all you have to do is one drug, fluoxetine, 20 milligram, other one 40 milligram. That's all what you need to do. So that's very simple. Then, what is counseling? Of course, counseling is not advising, because we advise from our point of view. If I advise, just last week, I had a girl, she's only 14 or 15, and her problem was mother is not okay. Okay, what mother says, she is spending all the time in the bathroom and she is seeing video call and all that there. So mother is looking at from a problematic angle. The child is saying, it's the only time where I can relax without nuisance of the mother. You get the point? Now, we don't know who is right, or maybe both are right, as this one says. There is some element of both. But on the first day, you can't talk about, take the mother's side. Always I tell the mother, I am not going to take your side, because if I take your side, then the child will never trust me. So I take the child's side, talk how beautiful she is, particularly talk about her eyes and blah and all that. Then say somebody else also has said this. Initially say no, then laughingly she will say one boy had said it. So you understand, you can get into the relationship issues. And then first session, don't talk specific things into it. Just say generalized things. We said, what are the good habits that I do? What are the good habits your mother do? What are the good habits you want to do? 3 or 4 new things. Just write it down so that next time when they come, have you done that? Great. That is great. Then once they have confidence in you, maybe you can get deeper into if she's actually having a relation or just spending. Most adolescents spend more time in the bathroom. It doesn't mean they are doing anything bad. Simple as that. Okay. Last week, again, I had another child who is again, into some affair. And she's asked me, should I kick him out now? I said, hold it. Last month, I'm saying, just hold it. Let the SSLC exam be over. Then we can discuss about kicking or not kicking. Because just before the exam, don't start doing all this, because the boy can be vengeance. So practical thing you must think of. Think of it as your own child. What is in the best interest of the child? The only word I will tell you, counseling is doing what is in the best interest of the client. There's no right and wrong thing to say. It is in the best interest of the child. That is the most important part. Counseling is a learning process. Counseling is aimed at helping people make choices and act on them. Particularly the girls have this problem. They don't have choice. So that is important. Now, this is only one more slide only. I will talk about counseling. We need to have a positive relationship building. How do you do? It's different, each one of us. I make all sort of funny comments. I make all sort of things. That my age and stature helps me doing that. I make sure I put a coat and all sit. You know, when they walk in and see me with a coat and all that, this fellow must be a difficult person. But the first thing I talk about is girlfriend, boyfriend, and all that. Suddenly they get a feeling that you are not that bad. You are at their level. So like that you may do, whichever way you do. But a relationship has to be there. Give them lot of opportunity to ventilate. Don't disturb when they talk. Ventilate whatever they want to say. Third one is they have hundreds of problems, but try to make 3 problems. But immediate, what are the 3 things that we need to address, and give a 1 priority number and start addressing the first one. Then also think of the client's role in the problem. We all say that that fellow did like this, he did like that, teacher said like that. Incidentally, suddenly I will ask, you didn't do anything wrong, no? You are such a good thing now. So I also did something. So what did you do? You do. That probably was a provocation. So remember, we also are part of a problem. Context of the problem, very important, extremely important. I am neck deep in a problem. Somebody come and say hello to me. I probably said, okay, hello. It doesn't mean I am rude to him. It's just that I am in that situation. So the context has to be understood. Prioritize solution. Who will say the solution? The client has to say in her own context, what is the solution she will suggest. Then out of that, you argue with them or reason out. Better word will be reason out with them. What will happen if you use this option? What will happen if you use the other option? Then help them, stand with them to implement solutions and terminate counseling, not more than 7 or 8. The maximum is 10 sessions. After that, if you can't finish it, then probably give to somebody else. Okay. Simple methods to imitate self-counseling will be meditation. I use that saying mantras, 101, whichever religion you belong to, you can have mantras. You keep chanting that mantra. It is that when you have 101 items, if your concentration doesn't, is there, you may make a mistake. So that way you practice mantra. Many relaxation techniques, maybe so many, I won't go into detail. Some free association, now everybody is saying mindful thinking and all that. Autogenic training, new visualizing, simple words, the best way, think of something in this college. Your good thing, whatever you were most happy with in the college. When you are in a very bad mood, just think of that. Go back to your school days, college days. It may solve your problem somewhat. Then, of course, Carl Rogers, seriously, if you are a counselor, full-time counselor, then you must think of person-centered therapy. I won't go into details. Carl Rogers, you may go into, I won't give examples because it take, okay, one word I will say. You are working as 2 person. Your inner counselor will say, how can I help you today? Haven't you seen in movies or, same person talked in the mirror and say as 2 persons, and one person say, oh, you are doing this because of that. The other one, both are the same person. He will argue, no, I am not doing that. I am doing that for. No, don't bluff me. Don't try to bluff me. I am part of you. I am within you. I know why you did it. Yes, maybe that you are right. What are we doing? You are taking the positive you and the negative you, argue with yourself and try to come to a solution. Then, of course, we have Albert Ellis' rational emotive therapy. We won't go into detail, but there are a lot of things we worked on that. Here, one example I'll trying to say, so what I am hearing you say is that anger is ruining your relationship at home and work, and you can't stand yourself. Is that correct? Okay. Then it's a perception checking. The client will say, that is right. I got into an argument with my boss and I was so upset, I took it out on my wife when I got home. All of us know this is happening, but we won't accept it unless there is a mediator in between. And that mediator can be you yourself. That is what is called self-counseling. You sit back and say, not as MKC, sit back as an ordinary person. Okay, you may be MKC. Everybody may be saying nice about you. So what? After all, you are just a simple person. You are not anything great. I don't accept you as great. Why did you do that? What right you have got to shout with your wife? Okay, you are right. You are right. So same me as two person will say, you are right. So that's the way self-realization comes. Then, of course, spiritual psychology. I don't know, we don't speak enough about this. And one mantra that I want to tell you is, all the psychology that has been taught is what is done in Western psychology. We have not touched Eastern psychology. I have done MA philosophy, and there I have learned so much of psychology of East, which is related to religion. Not only India, don't say it is related to India alone. Chinese is there, Tao systems are there, Japanese system, Arab, at one point, Arab was very strong in some of the psychological concepts. Unfortunately, our MA students also don't learn any of this. Let us go back to our spirituality, our own teaching, and don't make it as a religious issue. It is just teaching, because I have learned all the 7 religions, major, and I realized all religion teach you the same thing. They all say that you have to be truthful, you have to be kind, you have to be this. Okay, nobody say you have to be bad to another human being. No religion whatsoever say you have to be unkind to somebody else. But there is a difference in how you try to reach God. Some religion will say you yourself have to reach. Some will say you have to go with the flock. Then only you can do. That may be difference of opinion, but everybody teach the same thing. So a soul-centered approach believes that when love is applied to hurt, we heal. And that is the most important part. Now, I've just published a paper on self-counseling. This is from a journal Companion. I don't know, I hope you can see this. If anybody wants, I can send you also this. In which, very simply, it is said, self-counseling helps analyze oneself. It allows one to take control, to evaluate and rediscover. It increases the mental health conditions in the context of the increased mental health condition post-COVID era. And with the limited available trained physician to deal with, self-counseling can be an effective method to help candidates with mild issues. Theoretical basis for self-counseling involves the basic pros of counseling. However, the prerequisites for an effective self-counseling include, mark these 3 words. Just mark: self-awareness, self-motivation, and self-screening. And later on, I don't have time, but otherwise it will take a whole day workshop program. We have questionnaire on all 3: self-awareness, self-motivation, and self-screening. That is part of the thing. We have published some papers on that also. A successful self-counseling session needs finding strength in not just oneself, but also the support system, which may include the family and or friends. The problem with present day youngsters is they don't think their family is a support system. Okay, how can we do that? How can we encourage? And I always tell them, is your mother most difficult person on earth, isn't it? Sir, you are 100% right. So what have I done? I appreciated their dilemma that I love my mother, but she is a very difficult person to handle. You also appreciate it. And once you do this, then come back and ask, okay, throw away all the bad things that she does. Does she love you? You believe she is really loving you and she is overdoing because of love? That is true. That is true. This I'll tell you, I didn't learn today. At the age of 19, when I was counseling my classmate, this is the technique I use. And that is the same thing I'm continuing. that you are, in fact, it was his father who was so bad, so bad. So bad means, he had a girlfriend, so he came and took out the letters, made a mess of the whole thing. So he actually wanted to kill the father, sort of. I said, okay, I appreciated him and I used the abuse word about father. And I thought, everybody thought they will slap me, but he was so relieved. At least one person is recognizing my agony. But after that, you had to say, the way he reacted was so bad, but still he meant good for you. Now, this is the 10 commandments for self-counseling. If you want, you can even take a picture of this, shot of this. Number 1, do not bluff to yourself. Although we may have to bluff to others. Okay. Number 1, do not bluff to. You may bluff to everybody around. You can't, in this modern world of cruelty, you can't live without bluffing at all. Everything to be truthful, simply not possible. But at least you should not bluff to yourself. When I am doing a nonsense, I can pretend I'm not doing it to everybody else, but to yourself, you accept that I did a wrong. Why did I do? What is the consequence that I need to think? Number 1. Number 2 is you are not God. So you are likely to make mistake. So take precaution. Don't ever say, I'm such a good fellow. I come from such a good family. I studied in this school. So what? You are a simple human being capable of doing every nonsense in this world. And every counseling child comes to me, I start doing a self-assessment. Was I so bad as him, or I was even worse? Just do an assessment. This is the best way of doing self-counseling. I'm sure you are seeing at least 10 cases, at least a week, at least 10 cases of counseling. Just see the problems of the child and say whether have you done worse than that or have you done less than that. There's a self-assessment. Don't think others have to like you always. The problem now is you want like from every Tom, Dick and Harry anywhere in the world. But you don't want liking of your mother or father or friend, teacher. Our days, we were so fond if the teacher told you one good word. Okay, one word I remember throughout my life is my teacher once said, if you want to copy somebody, copy him. Even now I think I cannot, that sentence is so strong in my mind. I cannot do something nonsense which will make her think bad about me. Although the teacher might be dead and gone now, I don't know. But that is the thing. That's a power that our, close people have on us. So don't go for the internet love. How many liking you get. Go for self-love. You love yourself. Caring, not love. Kill enemy by caring when they need. A boy is telling you that I love you 20 times, send you photo, this thing and all that. Clearly he is a, gone case or he is a drug addict. No sensible person will send 100 messages, I love you, repeatedly and all that. The moment he overdo, you realize that all this will collapse in 1 week. Instead of that, a genuine person may not tell all this. He may be shy to tell that. But when you need something, he will come and help you. And just go away. Don't even try to credit for that. So caring is something you can feel with the heart. Love is something you hear with the ear. That is the most. Every husband and wife, you remember, whether you ask a question, does he care for me or does he, keep saying morning and evening, I love you? That's not important. Refuse to take it and also kill enemy by caring when they need. This is I have done throughout my life. So many people have insulted me, done. But what I do is, when I get a chance, I'll do something good for them. And never try, and run away. Don't try to take credit so that he will have a thinking in his mind. Why did I do bad to this guy? Let him feel it, not you. Refuse to take an insult. Be always happy. If somebody abuse you, I'm sure all of us will, 10 seconds, all of us will feel bad. After that, you think, did I make a mistake? No, I didn't. Then get lost. I am not bothered. If I did make a mistake, say sorry to yourself at least. That is the most important. Now, don't think others are lesser than you. We all compare others and that somebody is lesser than you. Nobody is lesser than you. This is very important. Everybody has their worth and you never know which part of your journey you may need that person's help. Remember. And if you take insult, only 30 seconds you take insult, then go the cognitive pathway. Already I said, but First, affect pathway is feeling pathway, throw away and go into the cognitive pathway. Think of other person's point of view, be a third party. If somebody insulted you, look as a third person and say, what did I say that he got so restless, angry? Maybe I made a mistake. Think of a third party. Two most important, do not hurt someone if possible, and do not hurt yourself ever. Pukraj was saying about this. It's a very important thing. Do not hurt someone if possible. We all hurt other people with no purpose. Just for the heck of it, we do it. We make fun of people. Somebody has a little defect. You make fun of that person without realizing within a minute, same defect can come on you. Some acid on your face. You will be the most ugly person on earth. Isn't it? So why think of that? Last one, of course, I am the custodian of my mind, body, and spirit. I will protect, preserve, and enhance it. Okay? Madam, I have two or three more slides. Shall I continue or stop here? Time factor.
So please continue.
Okay. Now, this is the self-counseling questionnaire. I'm not going, the questionnaire is a long one. I just see the domains: emotional self-awareness, social self-awareness, mental health issues, spiritual awareness, sexual awareness, physical personal awareness, and reproductive health awareness. All these are there in the journal article. Okay. So there will be at least 5 to 7 questions on each one. And the conclusion will say, most of us practice some self-counseling skills innately already. Try to find out which are the situations where I didn't buckle. I use my own skill, and that will improve your skill all over again. Okay. So that is self-counseling innately. How many times have you used it? Listening with an open heart, asking for clarification and probing around options and help most people get better. Listen to others. Ask some personal question. Don't jump at, even before that fellow asks you something, don't come out with answer. I know it. No, you don't know it. You do not know. You have to be like a judge. Listen to both sides, look at the law point, and then come out with a judgment. Not immediately, even without listening both sides, you cannot give comment. Further, learning how to work with deep-seated emotional wounds can also be mastered if one learns the proper structure. I'm sure all of us have deep-seated hurt feelings. I have, definitely I have. Very deep-seated hurt feelings. But you have learned to get over it. That's the most important part. How did you get over? That is psychology. That is psychology. And even if you don't know psychology, that part, by spirituality, you have learned. And who taught you this spirituality? Your parents have taught. That spiritual thing to withstand pressure, forgive people, and say it was a God's will. Forget it. Somebody, atheist may say that is a nonsense way of doing it. No. It just accepting that it may be God's will itself will, is a healing point. After all, all it takes is human compassion to heal deeply seated wounds, and that may have been there for years together. So all of us have this, and we may need to do that. So this is the place I work now, and we do have many programs, and sometime in October, we are planning to have, I have already discussed with our AHA persons, we may have a program, 1-week training, including development and adolescent counseling. Thank you so much.
Thanks a lot, sir, for this mind-blowing and splendid session. Geeta ma'am, are you there? Hello, Geeta ma'am, are you there? So, can we take question answers?
Ma'am is there. Shilpa ma'am is there. She is not. She's muted.
Now it is possible. I think now it has changed.
Yes.
So I was just trying that. So I think there are going to be plenty of questions. So can we take one by one?
Sure,
Fix
Sir,
the
the
time
first
also.
question.
Madam, fix the time also, so that the second speaker doesn't get lack of time. So
what
fix
to
the
do,
number of
Kavita?
questions. I can answer for any amount of time, but I think unfair to the
Sir,
next.
I will
Ma'am,
take in short,
we
sir.
can take, ma'am, 2-3 questions, then rest of the questions we
Okay.
can take in the adolescent group also.
Yeah.
Okay. How to deal with tragic events in adolescent life, like theft at home, because at that time parents were also not in proper state of mind.
Just repeat it. Just repeat it, madam.
How to deal with tragic events in adolescent life, like theft at home, because at that time parents were also not in proper state of mind.
Okay. Okay. I get the point. I get the point. Now, here we need to understand what is going on in the adolescent's mind. One may be the fear that something unexpected person had intruded into your privacy, and that scare may not go. It may even get into post-traumatic stress syndrome. That is one part. The second part is, the trust in people the child has probably losing because of that. The lack of parents at that moment time, they put them into fear that when I really need something, my parents, not willingly, but somehow it may not be there. But this can be taken in two ways. One may be that the destructive effect it can have on the psyche of the child. On the other side, a good counselor will make it as a chance for doing better. And I have been told actually by our former president saying that I just again and again I see that YouTube. He says when the SLV3, I suppose, went into Bay of Bengal, he was so scared. What will the chairman do? Chairman came and said, as if nothing happened, put a hand on his shoulder and said, I think we have a great opportunity to learn from the mistake. Something went wrong. Nobody will do it purposefully. So then from that analysis of the mistake that happened, it turned out to be the best one. And the next time when they were successful, they thought the chairman will come. Chairman didn't come and instructed him, Abdul Kalam Saab, you do the press conference. You understand the point? We can do two ways. We can get obsessed with the idea that this has created a lot of trauma to the child. On the other side, the counselor can take control of himself or herself and start discussing what a good way of learning it. There's some huge tragedy has happened. Not, of course, at the time when things are in a hot up. But slowly we can start saying, okay, I understand it has hurt you, it has created, it has shuffled you, it has, that throttled you, all that. But isn't it also a learning experience? Next time we will not be afraid so much of these things. So that's the way approach we should take. Both sides. In the acute stage, of course, supportive counseling. But after the acute stage is over, if the child has not gone into post-traumatic stress syndrome, then you can talk about use this as a positive counseling mechanism. Okay.
Ma'am, please unmute yourself.
Okay, now
So last question, sir, because this is very important. It is in mind of many. That presentation is correct, sir. Does this maturity comes? Does this self-counseling comes with maturity and age, or it can be inculcated in younger people too? Because self-counseling is not easy. This appears to be very relevant question. Is it self-counseling comes with maturity and age, and how it should be inculcated in a young people?
It never comes overnight. It is the way that what are the factors that help you doing that? You have innate support. You believe in the support of the parents. You are a God-loving person, not a God-fearing person. Okay? The first incident will shock you. But after that, I'll tell you, when I didn't get admission here, I thought that is the end of life. I thought I'm such a wretched fellow and everything. Think of all the negative in your mind. But the next year when I got admission in CMC and I went to a different place, then I said, my God had a different plan. So similarly, the way to understand that is you sit with your child, not somebody else's child. Ask him or her what are the deeper, provided you can make them feel that you trust him. If you can't do with your child, just go back to your childhood. the best way to learn and counseling is go back to your childhood, look at the trauma that you had to face. How did you manage it? What are the steps? Put it, write it down, not big sentences. Stepwise, you write it down. What did you do? How did you manage? I had an abuse in the childhood, okay, without even knowing it was an abuse, okay. But then I realized later on, when I realized that was there, the first time I'm actually talking about this. I never said this before in life, okay. It was a teacher. There was an abuse. But I didn't know. At that time, I didn't know it was an abuse, so I didn't bother. But later on, when I started realizing it's an abuse, I learned to laugh it off. Don't bother about it. Now, it has not done any harm to you. So, it is not maturity. It's a process of developing maturity. The first mistake we do is the child will go and bang against somebody. And then what do? We go and beat the table. We go and beat. We never teach the child to take responsibility. You didn't care. You are not careful. That's why you went and banged. But who gets the blame? The table gets the blame. Mothers should stop this. Okay? Instead of that, if you can clap and say, oh, very good, very good. You fell down, but you have got up also. Think of the thing. Learn from Punjabis, I will tell you. That is only society I've learned. Even if you have problems, they do not cry, because all their life they have gone through wars and all sort of problems. So that recovery has to be come from slowly. Now you will ask, can a counselor go to such paths? No, he cannot. But take one incident case of the child and say, how did you recover from that? And that will teach you all the steps of the self-counseling. Okay, madam?
Thank you, sir. I think we have got a lot of things, and there are many questions are there, but because of the lack of time, as the second speaker, Dr. Preeti madam, has to have time. So I think you can share your questions in the WhatsApp group. But sir, is it possible for you to see the WhatsApp group, sir?
No, but you send me the questions, I will give them.
I will go on sending you and then passing on the...
Send me all the questions together, I'll give the answers.
Yes,
but
sir.
Otherwise, groups
and I think
all, no, I won't be able to do that, manage
yes,
groups. Yeah.
No, I will send you the questions and all of you will get the answer. And the recorded...
I'll stop share.
Yes, sir. So, Dr. Kavita, we are having a recorded thing.
Yes, ma'am. We are having
somebody has asked the question. We'll share it on our website also, AHA website also. So all will get a benefit.
Requested also, sir, MKC sir.
Yeah, please.
Someone is requested also to share your counseling article also.
Yeah, both I will do. Both I will do.
I'll share all the questions.
But I'm saying, if you send in the group and all, 101 group I am there, I'm not able to see.
Because I'll send you personally all the questions.
Personal mail or WhatsApp, you send me a thing, I will send, then it will take.
And I'll give you a reminder also.
Yeah.
So I'll send you personally, give you a reminder also.
She has learned that reminder is so important for me. It's a good lesson that she has learned. Okay.
Thank you,
Thank
sir.
you.
Thank you. It was really wonderful, sir. Thank you.
Oh, here, who is sitting there? Oh, who else? Who else is there? I was thinking from Nagpur. No, it's not there. Okay.
Sir, Dr. Pradeep Kumar has raised the hand. Anything special you want to ask, sir?
Pradeep? Anything special? 1 minute.
Yogesh, unmute Pradeep, sir. Yogesh?
Madam, sir need to unmute from himself.
Yeah.
Yes,
Thank you. It is very excellent talk, and particularly spiritual practices.
Yeah.
And there is a advanced course in by Sri Ravi Shankar. Totally silence for 2 days and all that. So many activities are there, and that self counseling is very effective in that. That supports, as you have said rightly.
I'll tell you, I am a Hindu, so I can talk about that only. Every day, I'll chant 101 names of Shiva. It takes 3 times or 5 times. I do it morning and night. I do in the photo of Shiva Parvati. You do bindi, you put chandan and all that. Don't ask me scientific or not. It gives me such a sort of pleasure. And when I am in deep trouble, I go to the Shiva temple 41 days continuously to build child development center. 16 times
Yeah.
I had to do. 41 into 16 you do. Morning 4 o'clock, before 3:45 I should be there. I want to do it now, I am in deep trouble. But I don't, my age and all that doesn't help me to go at early morning. But I still did it a few months ago. So these are all things that each one can decide. Instead of cribbing, instead of crying, instead of telling, teach the child. And I tell you, my small child, you saw the grandchild, okay? She did it for some issue. And it worked out so well. She's so happy. Now she knows, I know the way. If there's a problem happens, how to get over it. Actually, problem may not have happened because of her doing it. It's just a question of time. But to pass on that time without worrying, to have the faith in something, all this work. Don't ask me question, have you done a randomized control trial to prove it?
No.
There's no need for that. It's only your faith, and faith actually heals. That's the point.
Yeah.
Thank you, sir.
Thank you very much. Thank you. Bapna sir knows it. Okay. Thank you.
Thank you, Dr. Shilpa. Over to Dr. Shilpa.
Yeah, sure. Thank you, ma'am. Thank you, sir. And after this jackpot of mastery, I would like to request Dr. Pukhraj Bafna, sir, to kindly introduce and invite our next esteemed speaker, Dr. Preeti Galagali, ma'am, for her engrossing talk.
Friends, it's my proud privilege to invite Dr. Preeti. I don't want to give details of what she is today. She is we all know that she's a glittering star of the adolescent health internationally. She has so many, you can see, you can just read the affiliations which she has, the major achievements and publications. But let me tell you, Preeti is the name of courage to realize dreams. Preeti is the name of results of tireless hard work. Preeti is of the name of pinnacle to academic heights. Preeti is a vision and strong will. Preeti is name of determination, full of self-confidence. She has a mission, she has a vision, and she has a passion for adolescents' work. Preeti is not just a personality, she is an institution. She is name of an idea. And let me tell you, friends, the topic which she is going to talk is about Heeadss. And this is digging out answer from a personality who is suffering from. I will not go into details and not take much of your time. I invite Dr. Preeti for her talk. Thank you so much.
Before Preeti start, I want to remind her, she herself had a problem in the academy or whatever. I won't say more details. And she was in a real difficult time. And she will remember now, She called me up many times. And I told her, same thing. Counseling was done. This is only a transient period. If one route is blocked, you go the other route. If nobody can destroy the inner strength in you. Nobody can destroy it. So she went to, I said, you will go international. If you have a problem national, go international. If you have a problem in the state, go national. I think she will recollect that now. I don't say it, but I'm just reminding you before you start the talk. Okay.
Thank you so much. It's indeed a pleasure to be here today amongst all of you. I can now say that Chhattisgarh is actually another home for me because I felt so much at home during all my visits to Chhattisgarh. I stand here and sit here in front of you with blessings from my teacher, Dr. MKC sir, and blessings from Dr. Pukhraj Bafna under the leadership of, and a very dynamic leadership of Dr. Kavita, Dr. Shilpa, team IAP Chhattisgarh, team AHA Chhattisgarh. Thank you so much. And as I talk to you about effective communication skills and Heeadss psychosocial history taking, which forms the basis of adolescent counseling, I would also like to acknowledge the AHA IAP Adolescent Counseling Program Presidential Action Plan under Dr. MKC sir's guidance in 2022 and Mission Kishore Uday program under Dr. Santosh Sowan's and Dr. Digant Shastri's guidance, and also Samvad NIMHANS, in which I have had some training about adolescent counseling. Thank you very much, IAP, AHA, and also NIMHANS. We all understand counseling is important for adolescents, and we wish adolescents come to us with these beautiful smiles. The adolescent is smiling, the doctor is smiling, and so is the parent. Is this very often in your clinic? I would just like you to introspect for some time. We also know that adolescent counseling is extremely important, and we all are familiar with the development of the brain. The brain follows the principle of use it or lose it. So in this stage of a person's development, when there are rapid biopsychosocial changes, there is a shift away from the family towards the peers. There is also a lot of media influence, a lot of peer expectations, family expectations, academic expectations, and also the social milieu has changed from a collectivistic society to an individualistic society. These are tough times for adolescents. But if we are able to reach to the adolescent, the brain follows the principle of use it or lose it. At this stage of life, we can motivate them for a lifestyle change which will last for an entire lifespan. So this is the most important part of life in any individual. I don't know how many of you have seen this beautiful movie Inside Out 2. And really, the adolescent there says, maybe that's what happens when you grow up, you feel less joy. There are so many issues related to body image, so many relations related to teachers, peers, and friends. And slowly, as the movie ends, she realizes that we are all a mix of emotions, and that's what makes us unique and beautiful. And that's what adolescent counseling is all about. But do the adolescents really come to us? So studies from India show that adolescents are not happy with the services that are available in both the pediatric and the medical care. They feel the services lack confidentiality, lack privacy. The healthcare professional does not give them adequate time, is not ready to discuss sensitive issues like those of sexuality, body image, drug use. There is fear of disclosure. The adolescent feels embarrassed. In fact, even they are scared of the adult reprimand or scolding that they may just get from the healthcare professional, just like they get from parents or other elders at home. And there is this stubborn defense. So how do we do this? We do this by understanding the adolescent better, by making our health services adolescent friendly, by understanding the adolescents. Adolescents say, I want to have a say in decisions about my health. Please respect my privacy. Don't treat me like a child. I don't want my parents to know. And if you want to learn more about adolescent-friendly health services, please do read the IAP recommendations, and the reference is right there. And I will also share this paper on the group. Now, in the next few minutes, so that we could reach adolescents in a more empathetic manner, in a more adolescent-friendly manner, I will discuss the art and science of counseling and psychosocial history taking. We will try to understand the definition. Dosar has already done great by actually giving his definitions and taking the topic into great depth, but I will briefly touch upon it. What are the aims of counseling, the ethics, the skills, processes of counseling? So counseling is a process by which a trained professional helps the client to identify problems. And these problems can be in the personal, social, or psychological domain. So adolescent may come to you, doctor, as soon as I see a new friend coming towards me, I get stomachache. I am not able to talk to that person, as a result of which I'm very sad I don't have friends. So you would realize that this is probably pointer towards social anxiety. So what is the next thing? You would like to brainstorm solutions and make decisions according to their psychosocial, spiritual, and financial needs, and give them the confidence to implement their decisions. So you may say, why don't you just join a painting class? You will meet more people, and when you meet more people, you will feel better. So the adolescent looks at you and says, oh, doctor, I hate painting. I don't like it at all. And so now is the time to explore how could you increase the social interactions, the social opportunities for social interaction by asking the adolescent what he likes. And probably the adolescent would say, I would love skating. Do you think I could use some of the techniques that you teach me there? So always remember, it is not our solution which works, it is the adolescent what he or she chooses. So it's easy to understand that the aim of counseling is to assess the situation and choose the option best suited for self and others to become self-sufficient, self-dependent, and self-directed for a meaningful and fulfilling life. Just like what Sir said, self-counseling, to make a voluntary change for improving personal effectiveness by facilitating behavior change, enhancing coping skills, and improving relationships. We all know the adolescent does not have a mature prefrontal cortex. So there's a high chance that sometimes adolescents may not be able to really tap into the self-counseling aspect. And for that, we are always available. So teaching the adolescent how to take help is also a very important skill. People are often confused. What is the difference between guidance, counseling, psychotherapy? If you look at these closely, there is an overlap, but let me just give you the broad differences. So guidance is making choices, decisions for normal individuals in difficulties. Which career should I join? Which is the best study skill to use? So here we give guidance. But for a disturbed or a distressed adolescent, where the crisis could be due to intra or interpersonal disturbances, counseling is required. Just like I gave you the example of that child with a social anxiety issue. Psychotherapy. Psychotherapy is usually done in collaboration with mental health professionals. And if you don't have the expertise, it is best to really refer the child, because here a little bit of restructuring of cognition is done, and it is often used in combination with drug therapy. So as pediatricians, I think we are fine giving guidance, and you all know about anticipatory guidance and also giving counseling. So counseling is a very niche area, and there are different types of counseling which are available currently. Counseling can be given in the individual mode, group mode, or even telecounseling. But please remember to follow the Government of India guidelines while giving telecounseling, and I will share this on the group as well. The other niche areas of counseling are educational, career, regarding a healthy lifestyle, overcoming mental distress, substance use, overcoming grief, issues regarding relationship, trauma-informed care, premarital, family marriage counseling, genetic counseling, rehabilitation, especially for children with special needs, addiction, and those with chronic medical disorders. So there are different specializations in counseling, but I shall tell you the basics remain the same. So what are the attributes and skills of a good counselor? So again, I would like you to just introspect on these skills as we list them out. A good counselor or an appropriate counselor is one who is trained, who's well adjusted with a good emotional control and knows the nuances of a culturally appropriate communication, understands growth and development of adolescent. So if the parent comes and complains, my child is now spending more time with the peers because he's 14-year-old, you can tell them that this is normative adolescent growth, and what you need to teach the child is how to choose the right kind of peers and how to handle peer pressure or peer persuasion. The counselor should also know the laws. For example, in our country, consent for history taking an examination can be given by a child above 12 years, while investigations and further treatment or drug therapy can only be given, the consent can be given only after the age of 18 years. And before that, we need the approval of the legal guardian or the parent. The counselor should have a genuine interest, open-minded and a flexible attitude, and offer confidentiality within limits. We'll talk about confidentiality in just a minute, but a word about empathy. So these are the classic Rogers triad, which Sir was mentioning about. Empathy. What do we mean by empathy? We mean by empathy is to put ourselves in the other person's shoes without removing our socks, accepting that we can never ever feel the way the other person felt. So this adolescent comes and tells you, doctor, whenever my father enters my room, I get very, very angry and I have to stop myself from hitting him. And what do you think at that time? You think, oh my God, what a bad adolescent this is. He has no respect for his father. Now, moment you think like this, you have become judgmental. You have also having your low empathy. And you can ask him, what exactly happens? So doctor, when he comes into my room, I remember my childhood when under the influence of alcohol, he used to beat me up. And that's why even when he enters the room now, though he has left alcohol, I feel the same feeling. Now, are you being more empathetic? Have you understood the context? So remember, as pediatricians, we should always take a history of adverse childhood experiences, which we often forget because the behavior may be linked to that. Congruence. I can give you the next 50 minutes of your time, I say to the adolescent, and I keep looking at my watch after 10 minutes of the counseling session. This is incongruent behavior. So say what you mean. Unconditional positive regard is respecting the adolescent irrespective of the behavior. Please understand the behavior is the problem, not the adolescent. Try to dissociate the behavior from the adolescent, because if you think the adolescent is the problem, you will never be able to counsel him. And if you feel so, please refer the patient to another adolescent-friendly counselor. So coming back to confidentiality, according to the Indian laws, personal health information should be kept confidential except in sexual abuse, suicidal behavior, crime, medical legal case, and hospitalization. So how do you talk to the adolescent? In the beginning, after you have introduced, you can share with me whatever you want. But in case I feel that in the interest of your health and safety, I need some other people to help me and you, I shall discuss with you and we shall choose or select the person who can help us the best. So remember, counseling, there is a therapeutic alliance. We are forming collaborative goals with each other, not only a working relationship, but the goals have to be formed together. So this is extremely important. The other few skills are leading. For example, I gave you the example of anger and the father coming in. So when the father comes in, what is your thought? My thought is that my father is going to hit me. What is your feeling? I get absolutely angry. What is your behavior? I bang the door on his face, or I just leave the house. So you know what you have done here? You have led from thoughts, feeling, behavior. So this will help you to understand the adolescent issues better. Self-disclosure. I can understand that when somebody has hurt you in the past, those feelings may stay for some time. It happened the same for me. So you can definitely discuss this with the adolescent, saying that yes, it happens with other people also. Right? Immediacy. Immediacy is the environment which you give the adolescent while counseling is there, whether there is privacy or not, whether there is auditory privacy or not, which is extremely important, whether the door is closed, whether the adolescent is sitting on a chair next to you and not across the table. Remember, humor is an excellent skill, but don't hurt the adolescent. Transference. When the adolescent feels that you are somebody important, just like somebody who's important in his life. So for some time, he may even consider you as his father or mother. And this helps you to explore his emotions in great depth. But remember, counter-transference can also occur when the counselor develops some feelings towards the adolescent and then the counselor needs help. Remember, the counselor has to also overcome his own barriers of emotions, physical barriers, language, cultural, finance, and also time constraint. Follow ethics. You're all familiar with the medical ethics of autonomy, non-maleficence, beneficence, justice. So please use that even when you are doing counseling and do not violate boundaries. Remember to take care of yourself, ventilate your feelings, and debrief with another senior counselor or a co-counselor. This will help you to maintain an emotional balance. So what are the communication skills? We all know that Communication is said to be 93% non-verbal. That is Albert Meherban's work. And it is said to be only 7% verbal. So we must take care of our eye contact. We should be at the same level as the adolescent. It should not be in a higher chair and a lower chair. Our facial expression should be open. We should nod our head. Our position of hands and legs should be welcoming and not a cross position like this, which is a very authoritarian position. Silence. Silence is so effective when you're communicating. Adolescent is crying. There's crowding of emotions. You can just give a pause if the adolescent doesn't want to say anything. There is no need to ask, what happened? How are you feeling? I know you're feeling bad. Just give it a pause. Let the emotions resolve. So holding hands, patting is good, but be careful that it is appropriate. Always remember to take consent, ensure privacy, confidentiality within limits, and respectful communication. Your verbal communication should be, we often say, the KISS principle. Keep it short and simple without scientific jargon. Your apt words, tone and pitch may be even considered non-verbal communication. Open-ended questions. Is your relationship with your father good? And the adolescent says yes. So this is a closed-ended question. How is your relationship with your father? It would only be better if he stopped hitting my mother. So now you see, you have entered the window, from a window into the heart of the adolescent. So open-ended questions which are not having answers as yes or no are very powerful. Active listening. What do you mean by that? There are 4 components of active listening. Paying attention to the adolescent. So doctor, I went to the new school and I saw the new teachers and the friends and I got scared. So what do you say next? Then what happened? I got so scared that I couldn't even breathe. I felt suffocated. So you know this is a panic attack which is setting in. So then you reflect emotions, you paraphrase emotions, you paraphrase words and said, so you went to the school and you felt very anxious about the new teachers and the friends. And then the adolescent says, oh, no, the friends is not a problem. It is the teachers that I'm scared about. So when you paraphrased, you got to know more about the adolescent's issue. So then you summarize and you say, oh, so you are having problems in the new school because of teachers. And then the adolescent says, but doctor, it is not all the teachers. It is only just this one teacher. So you understood that active listening, paying attention, minimal responses, by paraphrasing and also by summarizing, you actually understood what the problem of the adolescent was. So when an adolescent comes to you with an issue, always remember to praise. It's nice of you to come here today and share your feelings with me, validate emotions, empathize, address concerns, reassure, build hope. This is the bottom line of counseling. Even with one session, you can achieve this, and you have actually made a great bond with the adolescent. I already told to you about non-judgmental and avoid moralizing, preaching and giving solution. We have 2 ears and we have 1 tongue. So remember to listen more and talk less. That is what God wants us to do. And a small exercise for you, please tell me which is the better non-verbal communication. Is it 2 or is it 1? What do you all feel? Please write in the chat box. Which is better, 2 or 1? Assess non-verbal communication. Somebody can unmute also and answer. Is it 2 or 1? So I'm sure that you all feel that 2 is better because the posture is so much open, and you see in 1, there is an authoritarian posture. The adolescent is also feeling scared. So that is poor nonverbal communication. Interestingly, when I showed this slide to a group of parents, they all said 1 is better because they felt the parent was being very effective in the communication. So you can see how things may change when we know about skills and when we don't know about skills. So what is the process of counseling? What are the 6 steps of counseling? If we remember these, counseling should not be a problem. First is rapport building. So welcome the adolescent as he enters the room. Ask the adolescent the name and preferably the pronouns also. Ask the adolescent to introduce the accompanying people. Tell the adolescent your name and what is the work you do. Listen to the concerns of the parents. Take the adolescent in separate. as a one-on-one consultation and take a Heeadss history and assessment. And remember to rule out referral indications, psychosis, suicidal behavior, severe substance use disorder, mental disorder. And if you have been counseling that adolescent for more than 6 weeks without any advantage to the adolescent, you need to refer the adolescent. Remember, goal setting has to be done by the adolescent, not by you. And these goals should be short-term and long-term SMART goals, specific, measurable, achievable, realistic, and time-bound. You all are familiar with psychosocial history taking. You all know that this is an acronym which stands for taking history in the domains of home, environment, eating, body image, education, employment, activities, drugs, suicide, depression, sexuality, and safety. There are a few recent 4 additions, essays, spirituality. We were all talking about it, screens, social media, sleep, and strengths. For those of you who want to know, how do we actually handle adolescents in the outpatient or in an adolescent clinic? Remember, we need to interview not only the adolescent, sometimes the parents, grandparents, family, teachers, and peers. Offer confidentiality, take assent and consent according to the age, physical examination with a chaperone always. Management plan is to be discussed with adolescents and then with permission with the parents, anticipatory guidance, motivational counseling for a behavior change, and reinforce annual wellness visits. Why do we need a Heeadss psychosocial history? It is because we know that the adolescent behavior is influenced by not only the adolescent himself, but by family, school, peers, community, government policies, by media. And we know that parental and school connectedness and spirituality are strong protective factors. So we need to take a history in all these domains. That's exactly what Heeadss does. Heeadss analyzes multiple domains. It analyzes strengths, weaknesses, protective factors, risk factors. It elicits aspirations and goals, identifies areas of intervention, aids in strength-based and motivational counseling, and how to impart anticipatory guidance and advocate for adolescent wellness. And if you see at the flow of questions, they go from non-sensitive areas like the home all the way down to sexuality and safety. And yes, you have to change your style of talking according to the time available, age, development, whether the adolescent is vulnerable, whether the adolescent is from a child care institution, whether he or she has a chronic medical disorder, whether there's transition to adult care, whether you're talking to a parent, caretaker, or a teacher. I shall share with you a very fantastic article on Heeadss psychosocial history taking, which will tell you exactly what questions to ask. But I'm going to give you a snapshot. Just look at my cursor as it is moving. Who all are there at home? How is your relationship with your family? How is your performance in school? How do you see yourself 5 years from now? What is your ambition? How is your relationship with teachers or friends? What do you eat in the whole day? How do you feel when you look at yourself in the mirror? How do you spend your time after school? How do you feel after you use the media? Do any of your friends use drugs? What do you feel about media use? There have been times when adolescents are stressed because of what is happening in their life, and some young people think of ending their life. Has this thought ever crossed your mind? Have you ever made an attempt to end your life? Do you have a plan now? Has there been a change in mood or behavior for the last 2 weeks? Is one of the questions to ask to screen for anxiety and depression, and then follow it up with a patient health questionnaire too. Sexuality history, again in great depth. Are you in an intimate relation with somebody? You don't say, do you have a boyfriend or do you have a girlfriend? Because then you are actually doubting their orientation. So let's be open about it. As I said, open-ended questioning and flexible attitude is very, very important. Have you ever been touched or spoken in a way that you did not like? Let's come to a case 11-year-old girl, 6th standard student with tension, headache, and recurrent abdominal pain on and off since 3 months. Examination and investigations, normal. I'm sure this is a very, very common case that comes to all pediatricians. Now, the key here is to take a head psychosocial history in privacy and confidentiality. And there you have the stressors, you have the strengths. The strengths of the adolescent is the adolescent wants to become an engineer and is very good in sports and co-curricular activities and is very popular in the school. But the adolescent has a learning problem. And the stressors are poor parenting skills, abusive teachers, learning problem, body image issues, poor dietary habits, poor time management and study skills. So now you understand that why is this child having abdominal pain? And now is the time to set goals. Now, which you may feel, oh my God, abusive teachers, safety is most important. And you say, I want to talk to your teacher. I want to talk to your parents. Adolescent says, please help me with my studies. So you have to understand what the adolescent feels is more important. So you say, yes, we will work on studies, but your safety is also equally important. We will work on this side by side. But if you put down the adolescent and say, hey, studies is not important, it's only your safety that matters, you have broken your therapeutic alliance with the adolescent. Interventions, you will understand the interventions are very individualized according to the case. Psychoeducation is very, very important. What happens when there is stress? What happens when you get angry? What happens to your parasympathetic system, sympathetic nervous system? Please use science to psychoeducate the adolescent. What worked previously? Strength-based, solution-focused counseling, life skills, motivating for healthy lifestyle, relaxation technique, correct maladaptive beliefs, share a lot of communication material, clarify queries, homework. All this and more will be dealt in the subsequent sessions in this webinar series. So that's why I'm not going into details. Please remember always to partner with parents and plan a termination. Follow-up session. So I told you the six parts, the process, 6 steps of counseling. Remember, each counseling steps requires at least 2 to 3 sessions of 40 to 50 minutes each. And the interventions may actually require around 6 to 8 sessions. So follow-up may start with an icebreaker or a play activity. I often use tic-tac-toe to start my session. Ask for well-being concerns, discuss homework, what you have given previously. Goals and interventions for the session should be clearly laid out. At the end of the session, summarize and ask for queries, give homework, and fix up next counseling appointment. Remember, the aim is that the adolescent should not be dependent on you for life. You have to empower the adolescent with skills that will lead them to live a life independently. So the adolescent with anger management issues, once the adolescent is able to control his anger, you can increase the gap between the sessions and ask the adolescent what are his short-term goals. He says, daughter, I have controlled my anger now. I'm doing well in studies, but I plan to become an astronaut later. So you discuss the roadmap to long-term goals. Remember to always partner with parents. And I'm sure Dr. MKC sir is going to take a great session on partnering with parents. But please remember, you need to psychoeducate them. You need to tell them what are their roles and responsibility after seeking the permission from the adolescent. Provide unconditional support to them. Address guilt. Doctor, it's all because of me. Only if I had been a better parent. You have to address that because the parent is 24 hours with the adolescent and the parent is going to be your best partner in counseling at home. So please remember that. Facilitate positive communication, make them understand normative adolescent growth, guide them how to respond to adolescents' issues. Please tell them to take care of themselves. And also, if they have any problem like a mental disorder or economic distress, remember to partner with other social agencies and also with other healthcare professionals. Of course, ask them to ensure follow-up appointments. Now, I have this, an exercise for all of you. But I wonder if everybody can be actually, unmuted. So this is the last set of my slides, just the last 2-3 slides. Do you think there's an error here? So this is a child who comes with, adolescent who comes with smoking. And the counselor says, only bad girls smoke. And I know you're not a bad girl. Your parents have given you good morals. Follow them. What is the error? Would anybody like to say? Anybody who can actually unmute themselves?
It's a negative counseling should not be there, what I suppose.
You feel that, Kavita? So absolutely right. What has happened here is you're being judgmental. You have labeled the child as good or bad. You have tried to moralize and you have done preaching. So this is an error which should not be done at all while counseling. See the next sentence. Listen to me. Your friends are bad. Just stop going out with them. When they call you, ignore them. I guarantee all will be well. The intention of the counselor is good. But is there any error in this? What do you feel now, Kavita?
Again, ma'am, there's what I personally feel, any negative terminology, labeling someone should not be used in the counseling. So rather we can change the words. Okay, you decide, you tell me whether you find them right or wrong, what is the right about them, what is the good about them, and what is not good about them. So that
Kavita. So how do you feel about your friends is a question to be asked. You know,
yes.
How do you feel? You know, so that is the question. So giving instructions, do this not. Giving solutions to problems, unwanted reassurance. I guarantee all will be well. So the intention of the counselor is not in doubt, but the way the counselor says it is not the correct way today to do it, because we understand that adolescents do have autonomy bits. They want to follow a particular lifestyle. Our aim is to motivate them to make informed, healthy decisions. The last sentence, what did you say? You don't want to stop smoking? Why? Why do you want to meet bad friends? Do your parents know? How will your parents feel? Tell me, why didn't you come to me earlier? I'm your pediatrician. I'm your doctor for life. Whenever you have a problem, come to me. Again, intentions are good, but there is too many questioning. You know, too much questioning. You have to give time for the adolescent to answer, and you're encouraging dependence. Whenever you have a problem, you must come to me. I am your doctor for life. So that is not what we want to do. I will assist you is what we say, so that you become independent, right? So these are some of the errors and we should stay away from them. And if you want to learn more about counseling, we have this first IAP, AHA, IGJP book. Please read this. Also, we have this book by MKC sir, where we had these counseling scenarios and I had the honor of editing them. And the next issue of Adolescent Counseling, the next edition, will be out soon. So these are some excellent resources. So the key messages are, adolescence is an age of vulnerability and opportunity. Counseling adolescence is an art and science. I think more of an art. It is effective to overcome mental distress, motivate for behavior change, and nurture mental wellness. Privacy, confidentiality, empathy, exclusive time, non-judgmental attitude, Heeadss are important prerequisites for counseling. Remember to partner with adolescent parents, teachers, and mental health professionals. And remember to refer cases beyond expertise. And these are my 3 favorite quotes in adolescent medicine, which are the USP of adolescent medicine and counseling. People